Hello and welcome to General Practice Training Question and Answer podcast. One of my clients asked me a question. Can GP use AI ChatGPT for clinical notes? The answer was yes. However, there are a few issues with that. As Australian general practitioners, GPs, embrace artificial intelligence, AI, tools like ChatGPT and many others, they are becoming pivotal in transforming patients' consultations into comprehensive clinical notes. This leap in healthcare technology streamlines documentation, allowing doctors to concentrate more on patients' interactions. Staff and practice managers also adopt tools like ChatGPT. However, this transition brings up critical issues around privacy and the necessity of obtaining patient consent. The integration of AI raises concerns about the remote processing and potential overseas storage of sensitive patient data. Everything sent to AI stays on its servers and forms the new data. That data may come to use by millions of people. To mitigate risks, making patient data anonymous is paramount, ensuring clinical notes do not inadvertently reveal identifiable information. Yet, the practical application of this technology requires careful navigation to avoid compromising patient confidentiality. The integral component of employing AI in clinical settings is patients' explicit consent. GPs must inform patients about the AI's role in processing their conversation. Patients have a right to know how their data is stored and the measures taken to protect their privacy. The issue of consent is a tricky one, because even if patient signs some sort of form agreeing for the AI processing of their clinical notes, the consent will not be valid if patient truly understands what is the process. That places an enormous burden of responsibility on the practice to explain the process to the patient the way that any reasonable person would understand. Let's get some case studies. Let's say a GP sees a young man, Alex. Alex, known in their small town for performing at community events, sustains a unique injury from their uncommon hobby, competitive fire juggling. Alex details their recent performances and upcoming appearances during their consultation, where AI technology records the conversation. This specific information, if not becoming anonymous, could easily identify Alex in their community, underscoring the need for careful data handling. In other words, in the next day, week, month, a year, AI will give the data collected in that conversation to someone else as a story that could easily identify Alex, the patient. If that happens, if that becomes public, Alex would have a really good case against the doctor on breach of confidentiality. Let's proceed to the case study 2. Second case study is about work-related stress in a family business. Jordan, who is involved in a prominent family-run restaurant chain, discusses with Dr. Patel the stress stemming from family disputes and business pressures, a situation vaguely covered in local media. The AI transcription of this consultation could link Jordan to the discussed personal and business tensions if the clinical notes include identifiable details about the family business, the name of the restaurant, name of the manager, and so on, or the nature of the stress, highlighting the importance of consent and anonymization. AI in clinical documentation presents a promising future for enhancing healthcare delivery. Yet, as the case studies illustrate, it is crucial to navigate this innovation responsibly. GPs can use AI to improve clinical note-taking while keeping patient privacy and by prioritizing patient consent and implementing rigorous data anonymization processes. This balanced approach ensures that adopting AI technologies aligns with the ethical and legal standards essential to the medical profession. Thank you. Until the next time. Goodbye.